I'm a medical transcriptionist and editor, and that's what I do for a living for over 40 years. I woke up in the morning and was logging on to work, and I was having trouble typing. My son came in to say good morning, and I jumbled my words. So he called my husband. They took me to St. Mary's, and they did the CT and saw that I was having a stroke. That's why I couldn't talk.
When a stroke patient like Kathy gets to the hospital, the first thing that we do is we get CT scans. And in her case, that revealed that one of the arteries on the left side of her brain was completely occluded.
I kind of knew what was happening because I work in the medical field, so the symptoms were having a stroke because I couldn't talk or make sense when I was talking. And so I was scared, really scared.
So the important thing is to get that artery open and to restore blood flow as fast as we possibly can. In this procedure, the radiologist is able to use a small needle to introduce a catheter to the femoral artery, which is down in your groin, and by doing so can thread the catheters all the way up into the brain and use a little vacuum-like device to suck the clot back out.
Immediately when I came out of surgery, I was able to talk and make sense.
So what we did for Kathleen is we made sure that she had therapy services after hospital discharge. She worked with a therapist at the Life Center over many months, building up the skills to learn to speak again in a way that was fully fluent, and to the point that she was able to return to work.
It was very important to me to get back to the work that I love.
This easily could have been a career-ending stroke for Kathleen, but fortunately she was able to get medical care at the time of her stroke that prevented it from being a career-ending stroke.
To me, the joy in what I do is that you can be there for a patient on the worst day of their whole life, and you can make a difference that will follow them throughout the rest of their life.
If it weren't for the treatment that I got at St. Mary's, I would probably be disabled or not alive. I would tell Dr. McDonald, thank you for saving my life.